Evaluation. This video includes introduction to evaluation, meaning, definition of evaluation, assessment and measurement. Here we will see about difference between evaluation and measurement, nature of evaluation, purpose of evaluation in education and in nursing education, scope, characteristics, principles of evaluation and evaluation process. So what is evaluation? So this is an essential part in teaching where the teacher has to know about it very well, because as a teacher or as a faculty you have to evaluate your student for their achievement towards their goal. So it is an essential part in teaching. So when you study about teaching methods, evaluation is an important aspect. Meaning of evaluation: it means to ascertain the value or the amount of appraisal carefully. So you evaluate at the end of a learning experience how it is, whether the goal is achieved or not, and you do it with certain functions or certain tool. Definition of evaluation. There are plenty of definition given by so many people. Here we will see about 3 main evaluation definitions which are simple. So evaluation is the process of ascertaining or judging the value of something by careful appraisal. So you will look into the product very carefully and you will see whether how it is good or not. So which is called evaluation. So by simple way we can say you will just look into one person or you will look into one object and you will see whether it is good or not. That is called evaluation. Evaluation is the process of determining to what extent the educational objectives are being realized. So usually in education what we do, we will have certain goal at the starting, that is objective we set before starting a class, and at the end of the class we will just see or evaluate the student whether they met those objectives or not. For example, in this session as an example we have set a lot of objectives. Yes, I have given you a list of objectives. So at the end of the session I may ask questions and see whether the students are able to answer my questions or they understood the definition or the meaning of evaluation or the process or principles. So at the end of a process you will check whether the educational objectives are being met or not. This is called evaluation. So as per Wiles, it is a process of making judgment that to be used as a basis for planning. So it consists of, so the evaluation consists of establishing goals, collecting evidence concerning growth and lack of growth, and making judgment about the evidence and revising the procedures. So what he said is how the evaluation works is by setting a goal. So before evaluate, as a first step you should set goal and collect evidence and see whether there is a growth towards the goal or there is no growth towards the goal, and you make your evidence and do judgments and you will revise the procedure, or maybe it may be you may need to revise the teaching style or aviates what you used in your teaching, or it can be even you can change the goals what you set. So this is called evaluation. So according to Wiles, what he says is it consists of establishing goals, collecting evidence concerning growth or lack of growth towards goal, making judgment about the evidence, then you will revise the procedures or the goals in the light of the judgment. So you will find out why it is happening and you will revise the procedure or the goal. Assessment. Why we talk about assessment in evaluation? Because these two terms are almost similar and used together in most of the places, especially in nursing. So that's why we will see what is assessment also. Assessment and evaluation are the people who travel in the same road. Okay, so both of them has the same meaning and we use simultaneously in so many places. The word assess comes from the Latin verb assedere, meaning to sit with. So you have to sit with people and you will see how they are doing. Assessment can focus on the individual learner, the learning community. It can focus only the learner or the group of people or a class or the whole institution itself or the educational system. So assessment can focus only one person or a group of people or the whole institution or the complete educational system itself. Assessment is the process of documenting, usually in measurable terms, knowledge, skill, attitudes and beliefs. So if you document any process related to these things, like if you are going to can assess the knowledge, skill, attitude, beliefs in a measurable term, we say it as assessment. Assessment in education is the process of gathering, interpreting, recording and using information about pupils' responses to an educational task. So what is assessment in education? It will gather, interpret and record information related to the students. The next one is measurement. So what is measurement? It is appraisal in terms of a fixed standards, whereas evaluation implies the use of relative and flexible standards. You can make out from the measurement, it means the numbers. Yes. So in olden days, what we used to do is we used to get numbers. We used to get percentages. Nowadays, you can see the students in 10th grade and they say about grading, like A grade, A plus grade, B grade. So the measurement talks about the numbers, whereas the evaluation talk about the quality. What is the difference between measurement and evaluation, which is one of the important questions discussed in the, asked in the exams. So evaluation is qualitative, whereas measurement is quantitative. Evaluation is personal and subjective, and measurement is objective and impersonal. Evaluation is interpretative and philosophical, whereas measurement are precise and scientific. Evaluation is a continuous process. Measurement is not a continuous process. It usually happens at the end of the process. It's a new concept, whereas the measurement is an old concept. And it has a wider scope, whereas measurement has a very narrow scope. Next one is nature of evaluation. How the evaluation exists. It's a very broad program. It examines almost everything in the student's life, like achievements, attitudes, interests, personality traits, skill factors which are taken into consideration. It covers cognitive, affective and psychomotor learning. That's why evaluation is more better than the measurements. Olden days we used to focus only on the teaching goals, whereas now we are focusing on co-curricular activities as well. Evaluation is a two-part process where the first part talk about what to evaluate and the second part talk about whether the goals have been achieved or not. Okay. So the next, purpose of evaluation. So as per the Bloom, we discuss here the purpose of evaluation in general education and nursing education. So as per the Bloom, he has said some purpose of evaluation, that is to discover the extent of competency through which the student have developed. So from the starting of the year till the end of the year, what are all the things he has improved in his competency. It means his skills and knowledge, how much extent it is improved. It is to evaluate that we use the to find out that we use the evaluation. Diagnose his or her strength and weakness. So if you want to identify the strength and weakness of a student, evaluation is necessary. Apprise the status of and the changes in the student's behavior. So you want to make out, is there any student's behavioral change happening from the one part to the another part. So you need to evaluate the students. Assess the students' progress from time to time. Disclose students' needs and possibilities. So if you want to assess the students' progress and disclose students' needs and possibilities, evaluation is necessary. To predict the students' future in academic success. So if you want to predict who will be getting passed and who will be failing in the topic, so you can see the teachers comment about this in the class, like whoever failed, you don't pass in university exams. Yes, that is because it's a prediction done by the evaluation. Provide basis for modification of the curriculum and course. If you want to modify a course or a curriculum, evaluation is very important. Motivate students. So by seeing the marks, they will get motivated and they will try to do more. Improve instructional and measuring devices. If the teacher want to evaluate her media of instruction or her teaching style or whatever it is, evaluation is necessary to improve the teacher's efficiency also. Locate areas where remedial measures are needed. So evaluation sometimes helps us or the teachers to find out where and all there is possibility of changing the goal or setting a new goal to create success in the student's life. So purpose of evaluation includes discover extent of competency, diagnose his or strength, weakness, status of appraise the status of students' behavior, assess the students' progress, predict students' future academic success, provides basis for modification of curriculum and course to better attainment and growth of students and to motivate them to improve the instructional measuring devices, locate remedial measures. So purpose of evaluation in nursing, what almost same things what has been listed in the purpose of evaluation can be included in nursing, but there are some things which is needed here. It's not only the knowledge, we are looking for the attitude and skill in this nursing profession, because you are going to handle human beings straight directly into the directly, so attitude and skills are very important. It provides motivation, measures their achievement and their success, and of course, as we said before, students' strengths and weaknesses are measured. Students' clinical performance also can be measured or evaluated by this evaluation tools. Level of knowledge and understanding, gather information for administrative purpose, effectiveness of teaching and learning techniques. Scope of evaluation, it includes certification, feedback, monitoring the program. So whether the program is successful or not, you can come to know by the evaluation. Safeguarding the public. So when you evaluate, you will come to know who are all safer to go and do a health care. Baseline for guidance and counseling, placement and promotion in job, development of tools and techniques, and appraisal of the methods of teaching. So these are all the various scopes which is very wide comparing to the measurement. So these are all the areas where the evaluation is used. Characteristics, it is a continuous process. We have discussed this in the difference between the evaluation and measurement. It includes both academic and non-academic subjects. Procedure for improving the product. So if you want to improve a product, of course the best procedure is evaluating the product. Discover the needs of an individual student. So by the evaluation you can discover the individuality of every student. Correlation between educational system and the system of evaluation. You can relate how the educational system and the evaluation systems are functioning. Complex process which needs scientific techniques and tools. So for this evaluation to be successful, of course you need lot of techniques and tools. So these are all the characteristics. Principles of evaluation. Proper use of evaluation technique is essential, and when you use evaluation technique, variety of evaluation tools should be used, and select in terms of the purpose of your evaluation. What is to be evaluated, you have to identify and do accordingly. Objective must be clearly stated before starting an evaluation. All the evaluation things has to be kept for an evidence. Recording is very important. There should be a query from student or parent side or from the institution. It is necessary to keep the record of evaluation. Adequacy of experience is very necessary. That is the reason why evaluation is done by the experienced teachers. Evaluation procedures must contribute to improve decision of instruction and guidance at administration. Evaluation procedure must include improved decision of instruction, guidance, and administrative nature. Evaluation is a means to an end and not an end itself. Thank you.